All teams working out on these hot days. What are the warning signs of heat stroke? What can be done to prevent it? For answers, we go live to Intermountain Medical Center and emergency room physician Dr. Doug Dillon. Thank you for joining us, Dr. Dillon. First of all, spell out for us the dangers of heat stroke.
One of the biggest dangers with heat exhaustion to heat stroke, when you have heat exhaustion, your body temperature is less than 104 degrees, and when you go to heat stroke, it's greater than 104 degrees. And you can have some changes in your mental status. You can also start having nausea, vomiting. At some point, if it's not treated aggressively, this can lead to death.
Now, we were talking earlier in this incident at Granger High School that maybe a factor had been that the kids hadn't eaten breakfast before they went out to practice. Could that have been a factor?
That might have been a factor. I think the largest factor would probably be hydration and the length of time they stayed out in the heat.
And when you say hydration, sometimes it's not just enough to drink before you head out on the football field. You need to be hydrated hours, even a day or so before, right?
That's correct. Heat exhaustion is a combination of symptoms and leading into heat stroke. One of the things that we can do before and after practice is staying hydrated. And that means the ideal hydration solution would be a sports drink like Gatorade and water. So half Gatorade, half water before, during, and aggressively after practice. If you notice a decrease in your urine output afterwards, you're not drinking enough.
Yeah. And of course, football players aren't the only ones affected by the heat. A lot of people out exercising in the heat, working in the heat. What are the things that we should be aware of? What should we be looking for to make sure that we don't fall into this trap of having heat stroke or heat exhaustion?
So first of all, for prevention, the things that we should do is taking adequate breaks, staying hydrated as well as we can. During break time, see if you can get into some shade. Also get into some place that's a little bit cooler. The concerning things that we'd look for is if people started to have a headache, belly pain, nausea, if they started acting a little bit differently, those would be concerning things. Also, if they had profound exhaustion, that's a point where we need to stop, get inside, and make sure that they're adequately cooled and get rehydrated and seek medical attention if necessary.
Dr. Dillon from Intermountain Medical Center, thank you very much for joining us this afternoon.
Thank you.
Another incident.